Well, good afternoon, everyone. Welcome. We do have a few people in this room, so my speech is only about 45 minutes, so we should be okay. But please, we're very pleased to have everyone here today. I want to thank Don Seymour. Where's Don? The Executive Director of Watch, for hosting us here at Watch, and his board chair, Sue Easterbrooks, who's not here today, but thank you for having us here at your wonderful building. I'm Michael Baird. I'm the CEO for the South West LHIN. Also very pleased to have the Honourable Deb Matthews with us here today. As everyone probably knows, Deb is the Minister of Health and Long-Term Care, also our MPP for London North Centre. And Deb has got a special announcement that she wants to make for us today. And if you recall, back in November, Deb was here with us to talk about an investment that our South West LHIN board made for community services across the South West LHIN, investing $4.3 million for a number of organizations. Today's announcement is about mental health and addictions. And mental health and addictions is so important. I looked at a meeting that I was at back in the fall. I met with the public health, chief medical officers of health across the province, and they had just produced a report together with the Institute for Clinical Evaluative Sciences that measured the burden of mental health and addictions on the Ontario population. That report was so clear in demonstrating the impact of mental health and addictions on life expectancy, quality of life, healthcare utilizations. It's so significant, and in many cases, much more so than many other medical conditions within that we deal with on a day-to-day basis. So that's why I'm so pleased today that the Minister is here to make this announcement about the funding, because these findings underscore the need for us to invest in the appropriate services for mental health and addictions. Those findings also underscore the need for providers to continue to work together, and that's one of the jobs of the South West LHIN, is to ensure that our community mental health and addictions providers are working together in a collaborative fashion. And we've got great evidence of it here, and I'm so pleased to see representatives from across our geography. From Grey Bruce, we have representatives from here in Perth. Grey Bruce has done a great job in terms of bringing their community mental health providers together with Hope Grey Bruce. Here in Perth, and it's 7 organizations that have come, 6 that have come together in a new alliance to ensure that they got better pathways for clients to move throughout the system. And then here in the City of London, we have Watch, CMHC London, Middlesex and Search agreeing to move forward in looking at a merger between the 3 organizations. That's the type of collaboration and communication and connections that we need across the system. So it has been a great trip for us, and you'll hear more about how we came to the recommendations, our board came to the recommendations on the mental health and addictions investments that you'll be hearing about today. The second part of our announcement, so we're announcing the funding, which the Minister and Jeff are going to do, our board chair, but we're also going to be talking about the new enhanced mobile crisis response team, and you'll hear from Mike Petrenko, who's the Executive Director of CMHA London Middlesex, and he's going to be talking about that together with the Minister. So with no further delay, I'll invite the Minister up to make the announcement.
Well, thank you so much, Michael. It's truly wonderful to be here with you and look around the room and see so many people who have dedicated their lives to improving the lives of people with mental health and addictions challenges. You are wonderful people doing wonderful work, and I just want to say thank you so much for all you do. And I'm really happy that I'm here to be able to tell you you're going to be doing a little bit more. And thank you, Dawn. Where did you go? Dawn, for hosting us today at Watch. It's always wonderful to come into your home here and enjoy the surroundings. Thank you, and thank you for your leadership. Thank you, Chief Duncan. You and your team at London Police Services have really done an extraordinary job understanding that your job is to protect and serve the people of London the best possible way. I want to say a special thank you to Lorna Bruce, who was my tutor on work that needed to be done that was not being done and that needed to be done. I want to say thank you to all the partners who are here today. I can tell you that the spirit of collaboration, the spirit of partnership, the spirit of working together has been nothing short of extraordinary. I can't thank you enough for putting aside the best interests of your particular organizations and focusing on the best interests of the people we serve. Thank you for doing that and for making this good news happen. So as Michael Barrett, and of course to Michael Barrett and to Jeff Lowe from the LHIN, thank you. This announcement today demonstrates to me that collaboration at the local level, at the regional level, is absolutely the way to go. The kind of work that we're talking about today could not have happened out of Queen's Park. No matter how good the folks in Toronto are, they could not have put together such a thoughtful package for this announcement. So thank you to the LHIN for bringing us all together. So there are, as Michael told you, two very important parts to today's announcement. The first is that we are officially celebrating the launch of the Mobile Crisis Response Team, providing 24/7 care coverage for people who need help and need it now. This happened without additional government money. This happened because people in this area decided that by working together, we could provide better care. So we now have 24/7 team of people. I had the chance to meet a few of them just a few minutes ago, who actually go to where the need is, that help people where they are get attached to the right services right away. This is an extraordinary improvement in care for the people in this area. We know that we will see the benefits in the police department. We won't have people in the wrong place hanging out with Chief Duncan and his folks, and in our emergency departments. You know that this is a very, very good, it gets us much better value for money that was being spent. So thank you for making that happen. I actually know firsthand of someone who has benefited from this service, and she couldn't tell me enough about how much it meant to her and her family to have someone where they could turn to and get immediate help and excellent help. So thank you for that. The second part of today's announcement is actually, I'm going to tell you a little story. I've been Minister of Health now for a little over 3 years, and health is never without its challenges. There's always something, Michael, don't laugh. There's always something that can be improved upon. And I guarantee you, when I became health minister and I started to understand where our needs were the greatest, there's no question that the community sector is where I knew we had to make greater investments. I knew that people were in hospital who shouldn't be in hospital. I knew there were people in long-term care who shouldn't be in long-term care. I knew that our community sector, so strong and dedicated, was being starved for resources and needing to turn people away, and they ended up in less appropriate care settings that actually cost us more. So I knew that more money in the community sector was the right strategic decision. Now, I also happen to be minister in the time of a recession, a global recession where there just isn't a lot of new money. So I had to make some pretty tough decisions. And I had to say, doctors, love you dearly, value your work, but I can't pay you anymore. I was very happy that eventually 81% of doctors agreed that this was the right choice. It took a little while to get there. I knew we were paying too much for generic drugs. So you might recall that I had a little battle with that industry, but the end result is we were able to reduce the price of generic drugs in half, which frees up money to do more things in the community. Our hospital sector does a great job for us, but I had to say the hospital sector, 0% base increase. That's really hard for those big organizations. But it was all so we could put more into the community sector because that's where the need is the greatest. So in the last budget, I announced lots of zeros, but a 4% increase for the next 3 years to the community sector. And I said to the LHINs, you are best positioned to determine where the need is the greatest, where you'll get the best value for these dollars. We did say, we want you to get people out of hospital if they don't need to be in hospital, help our seniors age at home as best they can, and we insisted on a focus on mental health and addictions. So, because our South West LHIN had already begun the planning process, had the report, the time is now. They knew what was on the to-do list, they know what the priorities were. They were already moving forward with the mobile crisis response team, but they knew what else they needed to do when money became available. So when the South West LHIN got the news that there was an additional 4% of the community sector, a certain amount of it allocated to mental health and addictions, $3.5 million, they knew exactly where that money would get the most value. So they've made their decisions, and today I'm really happy to announce that they're focusing on 3 particular areas, identified in collaboration with the whole community. Where is this money going to do the most good? Crisis response. So we've got 7 additional crisis response workers coming to watch. We've got across the LHIN more crisis response support. We've got more transitional care for people who are in the transition of getting the help they need. This is really important work that is being done, and so much more of it will be able to be done now. The third area takes me back to Lorna Bruce. And several years ago now, Lorna, before I was health minister, Lorna took me on a ride along. Lorna works with people who work in the sex trade in East London. I wanted to learn more about that. She taught me. In the course of maybe a couple of hours, I got a crash course in addictions. And I have to tell you the story. I remember when I met with Lorna at the beginning of this ride along. I said, "So help me understand the link between addiction and sex trade work." And I said, "What percentage of these women probably have addictions?" She looked at me as if like, "Okay, now I know you know nothing." And she said, like 99.9%. And I met a woman on that ride along who had become addicted to OxyContin, and her life had turned upside down as a result. She lost her family, she lost her home, she lost her business, and she was working in that trade. I said to Laura, I met this a lovely woman, a lovely woman, and when we dropped her off, Lorna told me that she might be ready for treatment, but the treatment wasn't ready for her, that there was too long to wait. So the third part of the investment comes from work that's been done on the whole opioid addiction issue. A particular gap had been identified that mothers and pregnant women were not getting the care they needed, and we could do a lot more by providing care for those women, because they were not only it was not only a problem for themselves, but it was a problem for their kids as well. So we've earmarked particular investment to help parents and parenting women and pregnant women with addictions. The story around Oxy has been an interesting one for me, and there's a lot of work ahead of us on that front, but I think we're taking the right steps. So today's announcement is a celebration. It's a celebration of a community coming together and making determinations about what we can do better. It's an extraordinary celebration of you. So I want to say thank you. I can't say thank you enough for, I just look around the room and I see so many people who have been my tutors in this journey. I pull so much out of the London experience, and then I'm able to to apply right across the province. You're fantastic people. You're doing wonderful, wonderful work. And I'm just delighted to be here to celebrate this meaningful step forward. Thank you so much.
Thank you, Minister. And you've done a great job describing the relationship between the government and the LHIN system. The government makes the decision around those increases in funding, whether it's in the community sector or other sectors that are within the public environment. But for the healthcare sector, they rely on the South West LHIN and the South West LHIN board to determine where is the most appropriate way to make those investments. And we've done a lot of work working with our providers to ensure that these investments are going to the right location. So I'd like to call up Jeff Lowe, and Jeff is our board chair for the South West LHIN. He's been our board chair since February of 2011, and he's going to describe a bit more in terms of the decision-making process we went through. Jeff.
Big crowd. I don't know why they always get me to follow you, Minister. Like, what am I going to say? Everything that needs to be said has been said, but I also want to repeat that this is a day for celebration. This is a day when like-minded people and like-minded businesses, whether they are the same business or not, get together to celebrate and chart a way forward. And as the chair of the board of directors of the Southwest Local Health Integration Network, that's one of the great privileges we have as directors. And that is to work with all of the providers as closely as possible, and it's not always possible, it's a big territory, to identify where the needs are more acutely needed and where we can make a difference. And that's what we try to do each and every day as board members with the South West LHIN. We take the work very seriously. We know you take the work very seriously, and nowhere do we see the rubber hit the road as closely and as clearly as in the community service sector. It's fascinating. It's a huge privilege that I have with that. The money that's been announced today is going to go a long way to help in mental health and addiction. The mobile crisis response team, this is fabulous. This is, as the minister's put it, great work that's going to interrelate with police services and with the needs of our community. So I think I'll just stop there and just say a huge thank you to the people in this room, to the people across the South West LHIN, to the minister and a ministry that gets it, that helps and looks to help and listens. And that doesn't always happen in all places. We all know that. But to thank all of the health service providers that have worked together tirelessly to address the issues of mental health and addictions and all the issues that go along with that. So thank you again on behalf of the board of directors. We have met, we have considered, we will continue to work on your behalf in the Southwest Ontario.
Thanks very much, Jeff. So you've heard about the new funding announcement, the $3.5 million that's going to a number of our organizations across the Southwest LHIN. And like the minister, I look around the room and see so many familiar faces of people that have worked so tirelessly to ensure that we're putting the resources that we've been privileged to allocate into the right locations to make the biggest impact. The second part of today's announcement has been referred to as by both the minister and Jeff Lowe is the new enhanced mobile crisis response team with Community Mental Health Association London Middlesex. So I'll call Mike Petrenko, the executive director of CMHA London Middlesex, up to tell us a bit more about that.
Thank you, Michael. Minister Matthews, thank you so much. Thank you everyone in this room who was part of the collaborative effort to create the 24/7 mobile crisis response system. It is indeed a time for celebration because what we did, we took existing resources and we listened to the community and we listened for months and months and months. I'll tell you, this was not easy, but everybody struggled and everybody worked and everybody came to the same conclusion. This is exactly what our community needs. And so we delivered. So at the end of June, the decision was made. We are going to convert what we had as some existing crisis services into a mobile response team. And credit to Christy Reese, our team leader for the mobile response. Christy, you have just done a tremendous job in organizing, getting it going, hiring the necessary staff, taking staff that were already in place, and blending it and merging it and making it an effective vehicle. I congratulate everyone in this room who participated in that process. It wouldn't have happened in another community. It happens here in London because we are unique, we are creative, we have a lot of opportunities that are still to come. We need to take advantage and build on some of these collaborative efforts. So thank you for all of that. Even through our soft launch, so we came to, in terms of the full team complement by the end of October. We met that timeline, that deadline, we got it in place. We've seen excellent results. And I'll tell you a little bit about that. From the end of October to today, we've seen an increase of 240% in terms of utilization of the service. The team has been in place, and we are now on an average called to service for 6 responses on each and every shift. It's an amazing amount of service that's happening right now. What for me is a powerful, powerful relationship in the role that London Police Services, and thank you to Chief Duncan and Bill Chandler for pushing this envelope. We have struggled in this community for many, many years with the increase of incidences that police have had to respond to mental health challenges. And they arrive and they are not criminal in most cases. They are cases of health and mental health challenges. And just to give you a sense of the scope, through November and December, of 158 calls that we received to the mobile team, 128 came from London Police Services. That's 81% of our calls are right now coming from London Police Services to assist and work in partnership. If there are security issues or threat issues, London Police Services are there to do what they need to do. But the frank reality is, most of the issues that are attended to are mental health issues and are best dealt with by mental health professionals. In this team of 10 people, 10 full-time equivalents, there are actually more people employed, but 10 full-time equivalents, about $1 million to operate this team. We've reconfigured it, and it's working, and it's effective, and it's proving itself effective each and every day. So I congratulate everyone on that team for the valuable work that they're doing. But the most importantly, the greatest benefit of these changes is to the individuals in crisis. They're now receiving the right support at the right time that they are requesting that support. There are faster response times, timely referrals, and a very strong, committed team of professionals. And this just doesn't work in ad hoc way. This works in a very planned and vigorous way with protocols that have been developed with London Police Services, with their communications departments, with all of our colleagues and partners, other mental health agencies in this community, and we work collaboratively together. Surge Community Mental Health Services in Strathroy deals with the county issues, and we integrate the services. They're easy to find, and there's one number to call, and the information is out there. Please take it to find out more about this very specific service. It's critical for people in our community to know that there is support when they are experiencing mental health crisis. If you or someone you know needs this service, please give us a call. The numbers are on the fridge magnets, they're on the pamphlets and on the brochures. Please give us a call. Whether you're working in the system or whether you're a family member or a friend, please give us a call if you feel the need is there. I want to finally thank Minister Matthews and Jeff at the LHIN and Michael at the LHIN and your whole team, because we need leadership in our community to make these things happen. They don't happen in a vacuum. And quite frankly, Minister Matthews set the challenge to our community and to this province to move and shift our emphasis away from end services, away from using the emergency department, away from using the high-priced help, if you will, because they are a scarce resource, in using more community-based services. In that vision and that leadership, is now in policy by the Minister of Health that was published a year and a half or so ago now, and gave us the challenge to shift our emphasis to prevention and to supports. And so the announcement of the additional investment to watch, to mission services, to the addictions agencies is really the best investment. And I give credit to our LHIN for making those decisions, because they deal with things up front, upstream, and they start to slow that tap so that we don't need the crisis and emergency services as much. So that's the beauty of this announcement, and I thank you all and all of our partners in this community for making this happen. It is indeed an exciting time. So thank you.
Thanks very much, Mike. You'll often hear the minister talk that to create a healthy community, to create a healthy population, it's not just about hospitals and community agencies. It's about housing, it's about nutrition, it's all those social determinants of health. And we've had the privilege of having a close involvement with London Police Services on a number of mental health and addictions issues. So I'm pleased to have the Chief here today, Brad Duncan, to tell us a little bit about his involvement. And you've heard it already with the Mobile Crisis Response Team. So, Chief.
Minister, pleased to have you here today. It certainly is a great day for London. I'm joined here today by other members of the service and board, Mr. Paul Pilato, who's a member of our Police Services Board, who I can tell you have been strong advocates for alternative ways to use us as police services and use certainly the services in our community. We've heard Lorna Bruce is here as well, Deputy Chief Brent Shea, who is the operations side of the house, and of course Bill, who is hiding. We've heard Bill's name, but Bill Chandler is right in the corner there as well. And I can tell you we are so pleased with the efforts of the Crisis Service Working Group. When we look at this as a collaborative effort, it's the London Police Service, and I'm going to name everybody here, the Canadian Mental Health Association, London Middlesex, London Health Science Centre, Mission Services, Search Community Mental Health, St. Leonard's, and Watch Community Mental Health. I mean, we talk about having to bring everybody together. As Michael alluded to, it takes a lot of work to bring people together, but the vision was there, and today we're here. You know, in the past, as we've heard, persons in need of mental health crisis believed there was only two alternatives for them. One, of course, was the police. The other one was to go to the emergency department. And we know that oftentimes those two responses are clearly not appropriate responses to the particular crisis. We have conducted a workload analysis that drove some of our momentum, and I can tell you that in 2011, when the report was released, we found that between 2005 and 2009, there was a 47% increase in our dealings with individuals with mental health issues. And I can tell you, obviously, we do talk about resources being scarce, but we know that if nothing had been done over the course of 2013, our involvement with mental health occurrences would consume about $14 million of our police budget, which is a considerable amount of resources. And now what's going to happen is we're going to have a more appropriate and effective response to persons in mental health crisis. And we're going to have the responses by mental health professionals who are trained to provide the necessary supports, and as we've heard, and which I'm very pleased about, is 24 hours a day, 7 days a week. And they will provide an appropriate mental health response to persons experiencing mental health issues in the community, but more importantly at their home, on the street, basically wherever the crisis takes them, they will be there. And this does not mean, as Mike's alluded to, that we will not be part of this picture, because we will still be part of this picture. Clearly, if there's imminent danger to individuals, we will be attending. If there is criminality, we will be attending. However, in the majority of cases, and it's interesting, the statistics are bearing this out, as Mike has indicated, we know that the individual is far better served by mental health professionals whose services will now clearly be more readily available. And as we said in the earlier news release, or heard some of the comments earlier, I said, the intent of this team is to de-emphasize and de-escalate police involvement with persons in mental health crisis. And most importantly, the strategy will effectively provide persons with health care and services that they need to address their personal issues. And those services will certainly be provided by individuals who are mandated, and now we hear funded, which is excellent, and is important, trained with the expertise to do so. I'm clearly excited, as my colleagues in the service are, because this strategy will really enhance our collective service to our community. And often those in mental health crisis or with ongoing mental health challenges have not been well served as possible. And we are grateful that together we've been able to collaborate with our community partners to create that better pathway for care. I would like to take this opportunity to thank the Crisis Service Working Group, as I named them at the beginning. I was well briefed by Bill as we went along, and I know there was many challenges in trying to bring this together. And so I think your singular vision for the community as a group has really got us here today. I do want to acknowledge the leadership of Michael Barrett, as CEO of the local South West LHIN, the vision of Mike Petrenko from CMHA, and of course the support of the Honourable Deb Matthews. We do need that leadership vision driven down from the top, and without that support, and it's not just about dollars. Dollars are great, Minister, we all know that, but it's about a philosophy, and it has to be carried right through the entire core of our community, and that's both at the community level and at the provincial level, so we thank you. I also wish to acknowledge Don. We've had many conversations over the months for providing your ongoing support with the work that we do collectively, and also, of course, to have the venue today for this announcement. And you know, every partner organization needs champions to make strategies work, and in particular this one. And upon the retirement of Deputy Chief Ian Peer, Superintendent Bill Chandler, who I would like to step just a little bit forward so we can all see him. Let's go. Bill became the London Police Service champion, and Bill brought the priorities to the working group. I know he spoke on my behalf in terms of the direction that we wanted to see our service go. And Bill worked very collaboratively with the group to bring about this strategy, strategy, and to ensure that we would get it implemented. And as you know, we've had the soft launch, and it's working, folks. It is absolutely working. So when we make the official announcement today, we can tell you, we know that all of your struggles to make this work, it's working today. And so, Bill, I thank you personally as your chief for your hard work and commitment to assist persons with mental issues within our community. And finally, again, as I said before, I want to thank all of our partners on behalf of the London Police Service for your collective and focused commitment to assist those who daily are simply trying to cope with their own mental health issues. And I know that this present undertaking, and mark my words today, will prove to be a significant milestone in our community on many levels. So again, we've waited a long time for this to occur. I'm really pleased with the results, and I know it's only going to improve. It's only going to get better as we work through all of the operational necessities that we need to. So thank you once again, and thank you for inviting me here today. Appreciate it.
Thanks very much, Chief. It's clear from everyone's comments today that success in any of our initiatives with mental health and addictions does require partnerships, does require collaboration, breaking out from our own organizations. And I think that's been demonstrated wholeheartedly for all the organizations, not only here within the City of London, but also in Elgin, Oxford, Grey Bruce, here in Perth. All of our partners are working strongly together to improve the care for clients with mental health and addictions. Our last speaker today is Don Seymour, and Don's been referred to a couple of times already. Don's the Executive Director of Watch, so I'll invite you up to say a few words, Don.
Thank you, Mike. Mr. Matthews, thank you for being here. It is always an honor for us to host you, Jeff, Mike Barrett, and Chief Duncan, and Mike. Thank you all for being here, and thank all of you. Look at this. This is quite something. You know, there's a lot of reports out there, national, provincial, regarding mental health and addictions, and there's a little report that we call The Time Is Now that started to drive our work. And sure, there's a lot of reports, but the time is now. The ink wasn't even dry when we started the work on The Time Is Now. And it has brought us together in a way to collaborate and cooperate, probably in ways we haven't before. And it is really hard work. I think if you were a fly on the wall in some of our deliberations, we had tough conversations. And I'm sure sometimes for the LHIN it was like you were herding cats, Mike, but
Wasn't that bad?
he says with a grin. But to hear Chief Duncan talk about this mobile crisis service, the soft launch, and it's working. It's already having an impact. Minister Matthews, we like having a minister who gets it, who gets that when you invest in the community, the dividends start right away. And I think I can speak on behalf of every provider in this room and every staff person that this investment, you will see an immediate impact, and it will be measurable immediately. And the dividends will be in the lives of the people that we support, and you will see savings in all those other services, especially London Police Services, Chief Duncan. The road to recovery should not start in an emergency room or in the back of a police cruiser. It should start in the community. And we've talked about the vision, and we've talked about many people have talked today about, a vision for the community. And we can take all those reports and all those big words and we can distill it into something really simple. Services where people need them, when people need them. And that's what this new funding will do, and that's what this mobile crisis service will do. It is a unique collaboration, and I think by the time we're done and by the time the ink is finally dry on the time is now, I think people will be coming to London, Middlesex, Huron, Perth, and Grey Bruce to see what we do and how we do it so that they can copy it and imitate it and improve the lives of folks with mental illness all over Ontario and Canada, hopefully. So thank you all for being here, and I guess now it's time to get to work. Thank you.
So that concludes our comments for today. Thank you to all our speakers. Thank you to all our guests for coming today to hear about this important announcement, both with the funding side and with the enhanced mobile crisis response team. You can see the impact that this is making. The point I want to emphasize is that the government has identified the need for investment in community organizations, mental health and addictions organizations. And as Don said, we have a minister who gets it, a minister who understands that if you're investing in those community services, you're going to see results that are coming out not only for better client care, which is the most important thing that we're focused on, but also value for money. The chief indicated that there's a $14 million savings that could be achieved by ensuring that these clients are getting care in the right location. So those are things to remember as we move forward for future investment, for future planning. Again, thank you for coming today, and please interact with each other and have a good time. Thanks.